Hello, this is Dr. Lewerenz. I hope you're doing good, and this even makes you more informed and potentially better. So a study just came out recently, April of 2022, in Nature, a scientific journal, very recognized, reputable journal, about how even mild COVID, okay, yes, the pandemic's over, but even mild COVID had significant structural brain changes noticed on MRIs pre and post COVID-19. So individuals. So the point here is, even if your COVID was mild and you had some, symptoms, if you will, for a week or two, you could still get some potentially long-term structural changes of the brain. So, let me just look here and tell you some general data about this. Now, again, this was published in Nature. This was a journal review. I do want to show you New England Journal of Medicine. I always like to make sure you know where I'm getting my stuff. The New England Journal of Medicine, Journal Watch, April 2022, this was, and it is a UK study, okay? And they studied actually 384 individuals. The thing that's interesting about this, so they had pre and then post COVID-19 MRIs. So, and they saw structural changes that were statistically significant. Tough word. So the statistics really shaked out on that when patients had, even mild COVID. Now, is this leading to long COVID? Is this leading to brain fatigue? Is this leading to, poor memory decline, potentially even dementia? Okay, we don't know yet, but I will tell you this, and this is why it's really important, and I even screen my patients, even if they're coming in for something else. What was their experience? What was their exposure? Were they vaccinated? Did they have significant COVID-19 infection in their life? Because just like other main viruses, like a shingles, like a herpes, like potentially even Epstein-Barr, there's evidence out here that these can structurally change our brains. And if we don't get on top of them, sooner than later, that they do show evidence of causing damage to the brain tissue, to the myelin, okay, to the neurons. And we see earlier atrophy in earlier cases of cognitive decline. So just like this article showed here in April of 2022, and this was tracking patients the first 18 months, by the way, of the pandemic. Okay, yes, pandemic's over, but are we still reaping the consequences of this bad virus on the brain? And will we still be seeing this, in the decades to come due to this? So my advice to you is get to a good functional medical doctor, a personalized medical doctor that's going to dive deep, okay, into your brain health and brain fitness, okay, and track it and prove to you that your brain is healthy, because it's the one thing you got, even if you have good health and good longevity, okay, that you need to function, or else you're not going to be satisfied in life, and I promise you that. Love each other, be well. This is Dr. Lewerenz.